Okay everyone, so in this video we're just going to briefly talk about hemorrhage control. I've got a patient here with a wound that in a minute will be bleeding heavily thanks to James, and we'll just quickly talk about some of the aspects of that. Now if you have got a wound that is in fact bleeding but not too much, you do have to think about the fact that the patient, that you need to be safe as well. Now I'm never going to say that you have to put yourself at risk to stop a patient bleeding, but I'm also never going to say that you've got to risk the patient's life because you want to put a pair of apron and gloves on. But you have to make that call when it happens. Use all your training, life experience, and all of that kind of stuff. See, look, panicking, she's got a glove on, all the patient's going to sit. Now what we need to do is put on some kind of absorbent pad onto the patient. I've put down just a couple of layers onto it, and then when we've got the absorbent pad, we need to be able to then put pressure onto the actual wound area. Before I've done this, it's important to check that there's no foreign objects sticking out of the wound, or any glass or any nastiness pushing out of the wound. Now hopefully with this pressure, the bleeding should stop. Now pressure obviously onto a wound is really important, but when you're thinking about it in your panic, you might put a load of pressure onto the wound over a large surface area. That can obviously not produce a lot of pressure onto the wound itself because of your large surface areas. So always think about the fact that the smaller surface area you can to achieve the pressure that you need is better, because then you can obviously put quite a lot of pressure through just your fingers, for example. When you're pushing onto the wound, you need to try and make sure that it isn't bleeding, it is in fact stopping, that your patient can tolerate it. You might want to shout for help to come and to aid you, and if you're helped here, they can do all sorts of things. So in order to help a wound stop bleeding, it's a good idea to get the heart lower than what the actual wound is. So you might ask your colleague to lower the head of the bed for you. If they can figure out how to use the controls. That's good. You might also ask them if they can, because I can always lift this limb in order to stop the bleeding, but that's actually quite hard work for me in my back. So you could ask your colleague to actually raise the feet of the bed, or maybe even tilt the bed so that the head is down and the feet are actually up, because that should hopefully stop the pressure of the blood on the wound as well. There you go, so the feet are starting to come up now. Okay, so once you've got in these positions, that's really good. So we need to keep the pressure on. Now what we might want to do, or we're tempted to do, is to actually look at the wound bed itself and take the dressings off and have a look. But if we do that, we can actually reopen the wound again. Also the dressings might have been saturated in blood and we want to now start to change them. So if we are going to do that, we want to think about that we might actually leave the lowest dressing in place and keep the pressure on, so we can keep that homeostasis of the wound, hemostasis of the wound, and then we might ask our colleague to pass us another dressing so we can put over the top. Also, you wouldn't have thought James worked in the library just recently. Thank you very much. And cover that wound again with a new dressing. Now once we've got this, we also need to then leave the wound safe, and so we might want to actually put a bandage on this wound, a nice tight bandage to make sure that we've obviously got blood supply to the person's foot, but also that we can actually achieve pressure on the wound itself. Obviously once you've done that, you need to take all the normal steps, so escalate it to someone. You might want to do whatever tests or examinations you need to on the patient to make sure they're safe and that this wound can be closed. Okay, thank you very much.